Abracadabra.
Surgery, a science that has changed radically over the years. Today, those of us unfortunate enough to need an operation can sleep soundly, while the most advanced technological tools are used to perform tasks so delicate that they would have been impossible only a few years ago. Lasers that can weld a detached retina back into place, that can cut open flesh and seal the wound at the same time. Special microsurgery techniques that can repair tiny vessels and nerve fibers. Fiber optic cameras that can allow surgeons to explore the stomach without cutting it open. Ultrasound devices that can monitor the condition of an unborn child. Total body scanners that give the surgeon a complete three-dimensional picture of a patient's inside. You know, if you need surgery, you couldn't have picked a better time than now.
Today on the program, I'm very pleased to welcome three great guests to talk about surgery. Now, they've come through the time tunnel from their own periods in history, so let's give them a big round of applause. Please come in and take a seat. Now, coming to you first, you lived over 11,000 years ago. Now, what's your involvement in the history of surgery?
I used to drill holes in people's skulls. Trepanning, we used to call it.
Why did you do that?
To release demons.
But, wait a minute, what happened to the people whose skulls you drilled holes in?
They died, usually. But it got rid of the demons, though.
Or was this the only way you had of treating the ill?
Oh, no. There was a witch doctor who used to kind of sing and dance, jump around their patients, giving them magic potions. But I much preferred drilling holes in people's skulls. Yeah. Occasionally it worked, you see. A very delicate operation, messy business though, because we can
Well, moving on to my next guest, who is a surgeon from the Middle Ages. Oh dear, you seem to have got rather a lot of blood on your clothing.
Yes, I've just done an operation in 57 seconds.
Oh, well done. How's the patient?
He's dead. Hardly any of my patients survive. Well, I say hardly any. I mean none. None of them ever survive. Doesn't happen to everyone, it's just that I'm a terrible surgeon, absolutely.
Were all surgeons as unsuccessful as you?
No, we have physicians and apothecaries, chemists you call them nowadays. Some of them do all right, but most of us surgeons are really butchers and barbers by trade. We don't really know much about what we're doing.
Yes, well, someone who did know what he was doing is our final guest, Dr. Joseph Lister. Hello, Doctor. A British surgeon in the middle of the 19th century. Now, Doctor, what's your view of the history of surgery?
Well, of course, we in the West have faced three major problems with the development of surgery. First, to find out how the body works. Secondly, how to operate without causing pain. And thirdly, how to avoid infection.
I see. And how have these been overcome?
Well, the main way of finding out about the body was by cutting up corpses. But this was looked down upon by both the church and the state until the 15th century. After that, we've been able to increase our knowledge about the inside parts of the body.
And what about the problem of pain?
Well, this has been overcome more recently with the development of anesthetics, like nitrous oxide, which puts people to sleep.
I see, and the problem of infection.
Well, that's where I come in, I'm afraid, because in 1865, I was the first surgeon to use antiseptic. You see, I'd heard of Louis Pasteur, who discovered that organisms in the air can make milk, wine, and beer go bad. So I thought the same thing probably happens with wounds. So I sprayed carbolic acid into the air and put some onto the wound as well to kill off those simple forms of life.
I see. And did you ever think of spraying it on the surgeon's hands and clothing?
No.
Well, you see, germs can be carried on hands, in water, on clothing, on surgical instruments. So these days, everything is sterilized.
Yes, of course. Why didn't I think of that?
So there we have it. Surgery. It's come a long way in a long time, and who knows where it's going in the future. So, from the Time Tunnel Chat Show, goodbye.
Data record entry 911.55ZB, subsection 17. Open file. Planet 3764, Earth. First human heart transplant performed 1967 by Professor Christian Barnard in Cape Town. Patient survived for 18 days.
Still rare operation. Survival rates vary. At some centers, 50% of patients survive for over 5 years.
Proceed data. First permanent plastic heart implant, 1984. Patient kept alive for 16 weeks, connected to machine by two 2-meter-long hoses. Operation widely criticized.
Half a dozen organs now frequently transplanted. However, only in life-threatening circumstances.
Close file.
If they looked after themselves properly, then they might not need surgery.
Unit failure. Report to maintenance for replacement of head unit.
Hello. Can you guess what I'm doing? That's right. I'm in the middle of an operation to remove my appendix. Don't get me wrong, I can't feel anything because I was given a pre-med injection beforehand to make me a bit dozy. And now I'm completely unconscious. Thanks to this lady here. She's the anaesthetist. She's giving me a constant supply of knockout gas mixed with oxygen.
Plus, it's my job to check all your bodily functions throughout the operation.
Great.
Clamp.
She's the big boss, the consultant surgeon.
We're just clamping and tying up the base of your appendix now, John, and then I'm going to make a little stitch there before we cut it off.
Great. Don't know what it means, but it's all routine to them.
Scalpel.
He's the theatre nurse. He's in charge of all the surgical instruments. All the rest of the team are junior nurses and theatre technicians. They have to check my blood pressure and my brain rhythms and weigh the swabs to check for blood loss. How's it going down there?
Well, the surgeon's just about to remove your appendix now, then we'll stitch you up and put a dressing on that wound.
Great. Fast work, eh? Whole operation only takes 10 minutes, start to finish. Then it's into the recovery room, where they check that my pulse and breathing are okay, then back into the ward to wake up. Don't know why I thought the whole operation was so frightening.
I suspect you've been watching too many of those horror movies and not finding out the facts.
I guess so. Anyway, looks like they've nearly finished now, so I better be off. See ya.
That was a public information broadcast on behalf of the Don't Be Frightened for Nothing party.
Are you happy with yourself? Or do you want to change? Do you want to look cool? Or do you think you're strange? Is there another person somewhere trying to get out? Cut something up or pull something out? I need a doctor to take away the pain. I think I'm gonna need surgery again.
Pain. There's a big, juicy problem for you. Pain is good for you because it's your body's way of telling you to avoid what's harmful. But on the other hand...
It hurts.
Precisely. And there's another problem for you, painkillers. How do they work? It's not just modern drugs, oh no. People have used all sorts of methods. Herbs, potions, hypnotism, acupuncture.
Chocolate cake, strawberries and cream.
What?
I'm trying to think of nice things.
You nitwit. Now come on, what is pain? Think.
Pain is a distressing sensation generated when pain receptors in the skin or internal organs produce impulses that are carried by an afferent nerve pathway to the brain. Ow!
Oh, well, that's amazing. You've just come out with the standard medical definition of pain.
Have I? Don't know what it means. I just know what it feels like.
Exactly. Pain is a feeling. It isn't a state of body, it's a state of mind. It's a fact that soldiers in battle can get really badly injured and not feel a thing.
Really?
Mm-hmm. And that some people can be given just a sweet, and as long as they believe that it's a proper pain-killing drug, it'll work.
Why?
I don't know. Nobody knows. Think about it.
futures. This is but one of them. 1,000 years from now, evil threatens planet Earth. But this is an evil that mankind could avoid. A lone renegade scientist gives all generations hope. He sends the World Library of Knowledge back through time. It is discovered by a schoolgirl. She now has access to more information than the Pentagon. She must learn to use it wisely.
Hi, Nora. Where are we going? What is going on? Why on earth have you called me at a time like this? I may be smashed to pieces by some car. Thanks a lot.
It seemed an appropriate moment to tell you something about surgical techniques, a branch of science that has made major advances during your century.
What do you mean an appropriate moment? Am I going to end up in the hospital or
Now
what?
is the moment to demonstrate the importance of surgery. It is often the last
What's going to
intervention
happen to
between
me?
life and death. All life is a series of endless possibilities. Your future is a choice based on decisions that you and your generation will take. Forewarned with greater knowledge is forearmed. You have been forewarned.
You know, a lot of surgery happens because of road accidents, ending up with smashed up people being rushed to an operating theater. But how can they help? Well, obviously, that depends on how bad the injuries are, but they save a lot of lives in here. Who's in there now? It's a guy who came off his motorbike. It seems he was lucky. Quite a few cuts and gashes, and his arm is quite badly hurt, but nothing really serious. The worst injuries are to places like the head or the chest, because you may not even know that they are there. They're hidden inside the body, but then that's the first thing the doctors and nurses will look for. But how can they find it if it's hidden? They check your blood pressure and pulse all the time. If the pulse starts rising and the blood pressure starts falling, it means that the patient is losing blood somewhere. And if they can't see how it's being lost outside the body, then there must be internal bleeding. What's going on now? I guess they finished cleaning up and now know what they have to do. He's not in any danger of dying, but it looks like his arm is quite badly hurt. Let's look. Memory, delete theater, read arm. Do you see that? Yuck! Ugh! That's the main cable of nerves that carries all the signals that link up the brain and the arm. You can see that it's quite badly torn, and all the blood vessels have been cut through round here as well. This is quite a tricky job. Can't they, like, put them together or something again? That's what they'll try and do. But if you think that this nerve fiber is only a half a centimeter thick and carries thousands of separate nerve cables, that's really a very complicated wiring diagram, especially when none of the wires are marked. Well, then how do they do it? All you need is a microscope, a needle and thread, and a lot of patience. And then it all becomes one of the most intricate cases of needlework that you could ever see. Then let nature take its course. How do you mean? Well, nature is a much better repairer when it comes to small things. As long as you put the two ends together, the nerves will grow back and connect themselves. They grow at the rate of 1 millimeter a day, and it doesn't even matter if they connect themselves up to the wrong bit. But it must make a difference. Yeah, but after it's healed, you might try moving your little finger and your elbow moves, because the wires are all crossed. Then the brain just steps in and learns which signals are going down which nerve all over again. And there you are, one lucky man who will be able to use his arm again. Wow.
The purpose of this demonstration was to pose a question to you, Nora. Surgery can save lives, but it is also increasingly expensive. Should people concentrate their efforts on repairing the damage, or is it more beneficial to stop the need arising in the first place?
I shall now return you, and there will be no accident. The driver will take another route.
You're wasting a lot of police time and energy. I mean, what is it with you? You like being arrested or something? Where'd you pick him up this time, Jack?
He'd only set up a stall with a big sign saying Lou the Chemist, just down the road.
Hey, it was a nice start, a nice pretty sign. Did it myself.
Okay. Come on, give me your story one more time.
Oh, come on, Lieutenant. I'm just trying to help people here, make them feel a little better. I mean, that's a good thing, isn't it? Making people feel better.
If people feel ill, they go to a doctor, they go to a hospital, they don't go to you.
Oh, come on, Lieutenant. You know hospitals cost money. What about maybe if you get very ill, you know? Maybe you need heart surgery. That can cost you something like $25,000, a lot of money. You could buy a lot of vaccines for that, help a lot of poor people, you know.
Oh, yeah, people are gonna feel better if they take one of your pills, huh?
Hey, I'm not offering a cure here or nothing, maybe. I'm just saying that if you cut out the sugar and the smoking and all that junk food that people eat, Well, you just feel a little bit better. Maybe stop you getting to the hospital. Preventative medicine, that's what I'm saying.
Oh, you're the big health king now, huh?
Sure, I practice what I preach. I don't take no sugar, I don't take no cigarettes, and I cut out all that junk food. And so should you. You're gonna look like a burger one day, you are.
Ah, come on. Have a coffee and get out of here.
Hey, thanks, Lieutenant. Yeah, put 5 sugars in there, will you? And give me a cigarette. I can't take coffee
Take him
without a
downstairs
cigarette.
and book him, Jack. Come
Hey,
on, you
I haven't had my burger yet. I'm starving. Put some ketchup on it for me, will you?
Hey, guess how you can find out what's going on inside your body without cutting it open?
Turn it inside out?
No, the correct answer is you can use one of these amazing machines, depending on what you want to find out. Like X-ray machines.
Oh, everybody knows about X-rays.
Ah, yeah, but there's X-rays and X-rays, kiddo. Like these CT scanners, short for computerized tomography. They actually use crystal detectors to produce 3D images of what's going on inside your body.
Extremely useful for diagnosing what's wrong and planning the treatment.
Thank you. Then there's ultrasound. Probes that emit a very high-frequency sound, which are bounced off the organs being investigated, and back to the instrument. These are then fed into an electronic system which converts sound waves into a TV picture.
So you can have a good look at what's going on. Then you've got
ECG machines.
Which measure electrical currents created by
The heart, EEG machines.
For measuring electrical impulses
Created
by
the
brain.
Fibre.
Optic.
End.
O.
Scopes. For having a look inside every nook and cranny of your body.
Taking tissue samples and even performing minor surgery without...
Excuse me.
Hello, Simon Creasy here on lasers. Of course, lasers have many uses in the world of medicine. For example, they can be used to burn away tiny blood vessels in the eye and weld pieces of detached retina. Sorry, I feel a bit queasy. Hello, Simon Creasy here on lasers. Of course, lasers have many uses in the world of medicine. For example, they can be used to burn away tiny blood vessels in the eye and to weld pieces of detached retina, pieces of detached retina back into place. In brain operations, lasers can be fired at malignant, cancerous growths. Oh, I'm sorry, can I have a glass of water, please? Very much. When used in conjunction with fibre optic cables, lasers can perform intricate internal operations. To do this, the cables are pushed up someone's... Sorry.
That was fine, Simon. It was fine. Oh, nurse, quick. No, cut.
Well, I've got a rose, and I've got a snake, and I've got the Leaning Tower of Pisa on one leg, and a snake going up the other leg, and I've got a couple of bunny rabbits frolicking about on my stomach.
I see. And you'd like me to remove all of these using our recently developed laser technique?
No, I was just wondering if you've got any ideas for what I can have tattooed on my bottom.
Whatever you're doing, stop it and watch this.
When a car hits you, it's with the force of 100 sledgehammer blows all at once. So it's no wonder that hospitals have to work so hard putting people back together after an accident. Surgeons have been doing pretty much the same for years. That's cutting people open and stitching them back together again. But they've got this cutting and stitching down to such a fine art that they can virtually transplant all the major body organs. Kidney transplants, liver transplants, and heart transplants, today they're almost commonplace. But there are two major things we haven't managed to transplant yet. One is the limbs, and the other is the brain. Although we've managed to transplant small areas of brain tissue, so I guess it's on the cards that a whole brain transplant will happen in the not too far distant future. And that raises an interesting point, because if you transplant the brain, you transplant the person. So surely when you do a brain transplant, it will be really a body transplant. As to arms and legs, well, it's possible now to stitch one back on that's been torn off in an accident. But when it comes to transplanting limbs from one person to another, that's much more difficult because of tissue rejection, when the body rejects the part of a body that's not its own. Actually, we may never have to deal with transplants anyway. Developments in bionic engineering, which is to do with building machines that connect up directly to parts of the body, have already given us bionic hands, artificial hearts, and even, would you believe it, bionic ears. given the real difficulties of a limb transplant operation and the real life-threatening risks it involves, it's likely that surgeons of the future are going to have to be trained in electronics as well as being traditional doctors too, because they're going to be transplanting electronic limbs directly which will connect with our muscles. And so we might not ever have to deal with spare part surgery again.
Oh, Brain, I'm so handsome, green and hairy. I must be the handsomest, greenest, and hairiest ventriloquist in the whole world.
You're the only ventriloquist in the whole world. You're unique. There's no one in the world that looks like you. Take people, for instance. They're quite different.
People? I hate people. Ugly things. I feel sorry for them. They're so ugly.
Well, some of them are so worried they spend money on plastic surgery to make themselves less ugly.
You're kidding. How can they be so vain?
It's true. They have facelifts to take up all the loose skin on their faces, rhinoplasty to make their noses prettier, double chin removing, sucking all the fat from around their thighs, silicone implants to make them look bumpy, tucks and stitches and cuts and grafts.
They pay for this?
It's a multi-million-dollar industry.
Wow! I'll start a practice tomorrow. They'll enter my hospital as mere people and leave nearly as handsome as the real thing, me. And I'll be rich. I am a genius. I'll bet some of them would give their right arms to have 3 limbs like me. Yeah, but then they'd have 3 limbs. Yeah, I better keep quiet about that.
Some of the male people spend thousands just to have more hair on the top of their heads.
Well, if they pay me enough, I'll give them green hair all over their bodies.
I don't think looking like an ventriloquist is what most of them have in mind.
Don't be ridiculous, Brain. Who could refuse my offer? For not very much money, I will plastic surgery people to have a face like $1 million. All green and crumpled. Ha ha ha!
You're tuned to Earth Channel 451. Over now to Holly Graham in our satellite studio for the latest news.
Hi there. It's June 25th, 2050. Now hear this. Brigitte Blanc, who was President of the United States of America back in the year 2010, was finally cured of cancer today in a routine 5-minute laser operation that would have been impossible just a few years ago. After 40 years in a deep freeze, she may be in for a few surprises. World President Yoshio Fujimoto has yet to tell her what happened to her old job.
20 years. 20 years I've been alone on this rock in the middle of the ocean, thinking. That's it. I've got it. I must get back and tell them.
Listen, transplant surgery. I was thinking, what about transplant surgery? It could save thousands of lives. I mean, you know, people die and some of their vital organs are still, okay-ish. You know, so you could cut them out and then stick them in somebody else. I mean, you know, heart disease, kidney failure, liver disorders, that sort of thing. It could save thousands of, Why does nobody listen to me?
Bortsett fra problemet med avvisning.
I can't cope with all this rejection.
Oh, so he knows about that then?
Know about all what then?
Are you happy with yourself? Or do you want to change? Do you want to look cool? Or do you think you're strange? Is there another person somewhere trying to get out? Cut something up or pull something out? I need a doctor to take away the pain. I think I'm gonna need surgery again. Pressure in the subway or a police car. Woo, woo, woo. Man in the street never got too far.
When the heat is on,
Doesn't matter how I'm gonna need